Okay, we move now on to our second satellite presentation. We're going to be hearing from Michael Graves, who is an architect. He and his colleagues have designed over 350 landmark structures, and they're credited, or he and they are credited with democratizing design, in particular changing the direction of public architecture. He's been decided to be one of the most influential people in healthcare design. I'm delighted, I hope, to introduce you to Michael Graves. Michael, hello. Over to you.
Hello, thank you. Thank you very much. This will be a very different kind of talk than Daniel's. I was absolutely enthralled by what he had to say, but this is a talk from the heart, not so much from the mind. I became paralyzed 10 years ago. I had a terrific infection in the sinuses. I couldn't shake it, and the doctors didn't know what to do, and it simply got worse. I found out later that what happened to me was that my sinus infection went to my brain and then to my spine, and ultimately paralysis set in from my upper chest to my legs. And so I have very limited range of motion. I have my arms and my head, and I can still draw, and I can still make buildings, and that's the good news. Here I show you a picture of me trying on my shoes, or trying to put on my shoes in therapy. And you might not think this is a big deal, but it is for somebody who can't reach their shoes and how to get their body over to get their shoes. My therapist there is telling me it would go much more quickly if I would use Velcro shoes, and I told her, no, I couldn't do that. They were too ugly. Then she told me I could get out of this therapy institution. I had been in 4 at this time and 8 different hospitals trying to solve my problem, and I found what was happening to me was more disgust for the rooms that I was in and wondering how I could fix them. But she has said to me, my therapist, if you're able to put on all your clothes in the morning by yourself, get into your chair by yourself, and get into the bathroom and do your morning routine with brushing your teeth and shaving and combing your hair and all of that, then you can get out of this place. So indeed, the next morning I did that. I stacked all my clothes neatly beside my bed and with underwear on top, and got it on, and took about an hour. And then with the aid of a sliding board, I got into my chair and finally rolled into the bathroom. The bathroom was a surprise to me because I hadn't, of course, I had been in bed, I hadn't seen my bathroom, and I looked up at the mirror, and the mirror started above my head, and clearly for somebody standing, and not for somebody in a wheelchair. Now, mind you, I'm in a therapy hospital that caters only to people in wheelchairs. So everybody here was in wheelchairs, and there was the bathroom built for somebody else. And I reached for the cold water to brush my teeth, and the faucet was out of reach. The same was true for hot water for shaving. I couldn't reach it, and there I was doomed to not do any of that day. And then I thought, well, since I'm a very positive person, I said, I'll have my office bring my electric razor the next day. And I thought, well, I'd better find out where to plug it in. And indeed, the plug was down on the wall, the base of the wall near the floor. I couldn't, of course, reach that either. So I was completely out of luck. And then finally, I show you here a bathroom with a horizontal drain. My shower had a curb, and I needed to have two kind of burly guys, clinicians, lift my chair and me over the curb to take a shower. But here, this problem solves everything. It's just a simple trough drain, and the water all goes to the drain and never goes to the other side. It's a perfect solution to that. But when I was in my bathroom and I wheeled myself out, and as soon as I came out, I found my doctor had entered the room for his morning rounds. And I said, "Oh, you're just in time. I want you to do something for me." And he said, "What do you want?" And I said, "I want you to go out in the hall where there are plenty of unused wheelchairs. Get a wheelchair and bring it in here and roll yourself into the bathroom. Pretend you're me." Begrudgingly, he did that. Good sport. And he rolled himself into the bathroom, and I said, "Now comb your hair." And he said, "I can't see my image. The mirror's too high." And I said, "Now turn on the faucet." And I said, "Be me." In other words, my range of motion from here up. And he said, "I can't reach the faucet," and on and on. And so he backed himself out, and he said, "What's the point?" And I said, "Well, the point is, you told me that you had experts build this facility for you, and that you were spending $30 million on a new addition." And I said, "Are the same experts building that for you, designing that for you?" And he said they were. And I said, "Well, then you're going to have to do one of two things. Teach yourself how to read plans," which I doubt you're going to do, but hire a consultant architect outside of the firm that you're using to read the plans for you. And then I told him the story of hotel design. I said, when we design hotels, we never do a 4 or 5 star hotel without building a model room. Did you build a model room? No, we didn't build a model room, he said. But in all my healthcare experience, we're building model rooms to make sure that the clinicians and everybody else, all the stakeholders are happy with the outcome of the shape of the room, the location of the bed, the location of the bath, the view, everything about the room is seen before the building is built. But he didn't get a consultant, and he built the addition, and it is just as bad as the first. Some people never learn. This shows a picture of a hospital that we did in Tallahassee, Florida, where the original architects who did the building behind that you can see called us and said they couldn't get their design through the city planning bureau, and could I come and give them a hand. And so I designed this, and you can see the lobby on the right hand side as you enter the building. And so we got the porte cochere and the lobby built for them, and all the public spaces. Very happy about that. But the next slide is the Philadelphia Eagles football team, where we built their training center, which is not unlike rehabilitation centers today. This is what we try to do to get people back into the condition that they should be able to face a daily existence. We worked for a while for a company called Drive, and we built a bath bench. You see it there on the left. It happens to have oval legs. The legs are oval because, as you see, it has little holes in it so that you can push it up and down to get the proper height for yourself. And if the legs would have been round, you would have been forever looking for that little orange activates button to pop through. So the oval shape ensures that you'll get it right. But we wanted to make a bench that could stay in your bathroom no matter whether you were the one using it or not, and that it would be good enough looking and functioning the way you wanted it to, so that it wouldn't say somebody disabled lives here. On the right-hand side is a rollator with a dual seat position, one on the left where you can sit down and have somebody push it for you, and then one on the right where the pusher is on the back side, and then finally the whole thing collapses and can fit in the boot of your car. Here, a small pouch where you can put your billfold, your keys, your sunglasses, and so on. And if you're taking a walk and you get tired and you need a cane, you unzip the bottom and a cane comes out and straightens up. It's on a bungee cord inside, and it becomes a walking device for you. And then when you want to pack it up, you pull the three parts apart from each other and put it back in the pouch. Nothing could be simpler, but you can simply take this on your way to a sporting event or to shopping or whatever you're doing, and if you get tired, you can use it in that manner. I show you a picture of the kind of state of affairs of American and I suspect English patient rooms. But here is this elderly lady in her bed, and as you see, I've circled several of the figures in the room. One is on the right-hand side is the television, which she can't reach. She'll have to call the nurse to get her television brought over for her. She can't reach it because of the railing on the side of the bed, and it's simply too far. Somebody has not thought about her range of motion and her reach to make sure that she can bring it in range for her to use it. There are her tissues on the night table, and she can't reach them either because of the railing on the side of the bed. I suspect if she were able to fish her arm through one of those openings and use the tissue and wanted to throw it away after use, it would be a real basketball hook shot to get into the wastebasket, as you see way over in the corner. Again, out of reach, even out of sight. On the radiator is a pink dish there, which is a female urinal. Now, the female urinal is on the radiator. Think about that for a minute. Well, actually, don't. And then I didn't ask her about the male urinal, which is hanging on the end of the bed. But this is the kind of thing that we want to try to not just clean up, but make more functional in the room. So it's a healthier room, a room where you can really convalesce in. Sorry about that. I have here something we did for another healthcare company called Stryker. Stryker makes devices for the body, but it also makes furniture for the room, for the patient room. And they had a over bed table, which was a huge affair. It had 3 or 4 levels of tops that could pull out, mirrors and cup holders and so on. And all of it was getting dirty because the cleaning crew was not doing their job. And 99,000 people a year die in the hospital because of hospital-borne infections, mostly coming from the lack of cleanliness in the room. But we made huge handles on the over bed table so that the cleaning crew would know that's the place to clean. They're on both ends of the table, as you can see. The table is divided into two pieces, one for your lunch or breakfast tray, and the other for your Kleenex or your tissues and your cell phone and so on. It's important that they keep the wooden part of the tray clear because the lunch group who brings in the tray has to have a clean surface to put the lunch on the tray, or else they'll take it back out in the hall and leave it next to your door until you clean your tray table. Here is another device that we made for them, which I call R2D2. It can slide over the bed, as you see where the blue arrow is. That lid also comes down. But there, the little blue wastebasket is on the piece of furniture and very close to the bed. And there again, the big handle, so you can slide this around the room. It's on wheels. It has a drawer that works both ways. In case it gets shoved up against the bed, you can open the drawer the other way. It has a stopping point in the middle. And then below that is a blue plastic tray where you can keep your valuables. It's got a logo for the hospital on it, and you can take it home with you instead of a brown paper bag. You can take this blue tray home with you, and the hospital replaces it. This is a chair that we made for the hospital room, which is called a stand-assist chair. I was in a restaurant and I saw a man who had had a stroke. He was at least 85 and very frail, and he walked up to the table with his equally frail wife, and they stood there at the table, and a chair was brought for them by the waiter and put behind his knees, and it had no arms whatsoever, and he worried about how he was going to sit in this chair because he had nothing to hold on to. He couldn't hold on to the table because the tablecloth would have come with him, and he didn't have the strength to put the reach to put his hands down on the seat of the chair. So finally he worried about this. I couldn't help him, or I would have, because I too was in a chair. And finally, with a great plop, after 10 minutes, he sort of fell into the chair. This shouldn't be. If they had had a chair like this, he could, and you see how the handles are out in front of the seat, like a shepherd's crook. You can grab onto those very easily and back yourself into the chair. And here, reading from right to left, let's make believe this figure is our old gentleman, 85 years old, and holding on to those shepherd's crooks, and then backing himself into the chair, and then pushing himself back when he gets to the far left frame. Or opposite, he can get out of the chair in the same manner. In frame 2, he's looking down at his feet, and the clinician says, or the therapist says, nose over toes. And try this tonight when you're going to bed, sitting on the edge of the bed, taking off your socks or your shoes, and put your nose over your toes like this, and then stand up. You'll find how much easier it is because of your equilibrium in your torso. Here's the whole family we did for Stryker. Several pieces of furniture, and then again the stand assist chair. Here is the over bed table in the lower left, and you can see a kind of paddle under the tablet of the top, and that is to lift the lid up or down. You can do that with one finger, up or down. It's very, very simple. We've made it that way so that anybody, no matter what their affliction is, can use this tray table. And finally, for Stryker, we've made a transfer chair that will replace the chair that most hospitals use. I know in the States, we use a hospital that was designed in 1933, and it's still in use today. You can imagine how uncomfortable it is. But that's the state of affairs today in American hospitals. Here we've used the stand assist arms again, but the patient, if he or she is in bed and going down to have an MRI or a CAT scan or an X-ray, they'll generally get in a chair like this and be taken down by a clinician. But once you're in the chair, then those footrests can move down, and you can put your feet on them, but they won't trip you as you're getting into them. The existing ones have footrests that are constantly down, and so they're tripping the patient as they get into the chair. The back of the chair is seen here, and you can see an X down on the ground where, again, the clinician does not need to bend over. This is one of the big issues, that the nurses or the orderlies' backs are being tested by having to reach down to brakes and that sort of thing. But here they can do it with their foot, one to put the brake on and one to make the brake release. And there you see the oxygen tanks, which are on the back of the chair, and the pole is obviously for an IV. Here's the chair with the arms going back. If I were needing to transfer into that chair from my wheelchair, I would go along to the side of it, parallel to the chair, and transfer seat to seat. But the arms would then swing back, as they will on my wheelchair, and then I can get into that seat. And there you can see in the bottom how they stack, because space in the hospital is very dear, and therefore finding a way to get these big pieces of equipment out of the way is very important. And finally, here I made a little gouache of the room as we imagined it, as I imagined it. And here it is with the overbed table and the stand assist chair. If you don't like the room, you can always look at Tuscany there on the wall. Next, I wanted to show you pictures of a project that we did for the Army, the American Army, where soldiers are coming home from the two wars that we are in, and there are many of them. And if they can't find a job, they can re-enlist in the Army and have a desk job. And to do that, they need a place to live. And so the Army commissioned me to make prototype houses for disabled veterans or disabled servicemen, really, who have reapplied for 2 more years of service. And they come with all kinds of afflictions, from post-traumatic stress disorder to amputees, both arms and legs, to partial blindness, to all kinds of things that are unspeakable, really. And they're given one of these houses for the 2 years that they're on the base working for the base. Here's the house at night, one of the houses, and then the red house you can see in the distance is a similar house with little changes, so that there'd be variety in the kind of house the service person can choose. The use of trellises was exaggerated here, as I wanted these houses not to scream in any way somebody disabled lives here, but these are normal houses, and you can see the wisteria starting to grow up the side of the house, and that'll go across the wisteria and in the next few years bloom purple and be very pretty in the springtime at least. And there's the house on the right-hand side. From the back side, where there's a grand porch where people can eat under shade and protection of the rain, and then outside a little terrace, also with a trellis surround. The alternative house is seen here. It's distinguished by an octagon on the left-hand side, which is used as a family room, a kind of TV room. And they seem to love that. And the kids are very, very happy with that room. They have made all kinds of games for it. And here are the two houses used as prototypes along the street. And you can see that they would fit in lots of different neighborhoods, at least in our country they would. And here's the use of tillage again. Inside is the plan of the house. It's pretty straightforward, coming from the concavity at the top into the front door, a short hall, and then a dining space and living room. On the upper right-hand corner is the garage. So if you drove into the garage, you could enter the house through the side wall, the lower wall of the garage, and into the kitchen and dump your groceries or whatever. And if you went on into the lower right-hand side of the plan, would be a family room, television, and breakfast and lunch counter. And the lunch counter goes up and down, as does the counter for the sink. I'll show you that in a moment. On the left-hand side is a string of bedrooms, master bedroom at the top, and then a string of 3 bedrooms, the last one being used simultaneously for a bedroom or a therapy room for somebody with post-traumatic stress disorder, where that requires that they be able to darken the room and curl up and do what they do in that case, where it isn't open and light, but just the opposite is what they want. Here's the living room, and as you see, not many rugs, because rugs and wheelchairs are not friendly to each other. I'm forever pulling up rugs in my own house with the wheels of my chair, and so I've gone to sort of putting masking tape underneath the rugs to hold them down. But here's the room, and you see the windows are almost to the floor, where there are still windows, not French doors, but the person in a wheelchair can see out very easily now. One of the servicemen told me that his wife said about this house that she would love to have it because she could see her furniture in it, and she would love to decorate a house like this. It's so different than the normal house. I was pleased with that comment. The television room seen here, and you can see the counter for breakfast and lunch. It's at the
Yes, but we can't hear him. Michael, I'm so sorry we've lost you. I don't know what to say. I'll just give you some feedback from the audience, which has been, just wonderful to see what you've done. Yes, so we're just going to have a big round of applause for you. If you can still hear us, you've made us laugh a lot, and I just love the idea right at the start of your talk about the hideous hospital design as an incentive to get out of bed when you've been very severely injured. That was rather remarkable. Just as an idea about some of the questions, this one made me smile because it's about how can we have more people thinking in design ways to overcome design constraints for patients. And I immediately thought of maybe we just need more architects as patients, which is a terrible thing to suggest. But I suppose if you're a clinician and you happen to be lucky enough to interact with an architect as a patient, you maybe need to really enlist them and make them help you see things in the way that really inspirational architects clearly can. So, Michael Graves, thank you so much for sharing that with us. You've really inspired us to go on forward and make better environments for our patients wherever they are. Thank you very much indeed.